what is more important, bariatric surgery or gastric balloon as a tool, because this is just a physical tool, really very powerful tool. But if to put bariatric surgery and to put our mind, our habit, mind resistance to that food which brought you to extra weight, I would say 50-50. Only combination of those two methods can be, I mean, psychotherapy and bariatric procedure can give us success.
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA shift UHC change that, or is there more? Or perhaps, what's the difference between a pharmacy with a blue cross and a green cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more? Women's health, men's health, your children's health, the economy, this and more awaits you on Season 2 of Kenya's favorite health podcast. My name is Dr. Diana Wangari Gitau, and welcome to Season 2 of the One Health Lens podcast.
Hello and welcome back to yet another episode of the One Health Lens Explained podcast. So in this conversation today, I'm talking about weight loss. What are some of the procedures that are there? What are some of the things that we can do to lose weight? Because we have been exploring so many options and so much has come up in the past few years. So I'm here with an expert who's going to tell us more about what are some permanent weight loss options that we have. I'm joined by Dr. Shchukina. Welcome. How are you doing?
Thank you. Thank you for inviting me.
Yeah. It's a pleasure to have you here. So could you just tell us briefly about who you are, what you do, how many years you've been practicing? Because you mentioned it's just a few years.
As you mentioned, I'm Dr. Shchukina. I'm a medical doctor. I am director and co-founder of Nairobi Bariatric Center, where we do weight loss treatment, surgical and non-surgical. In this field, I am already for around 27 years. That is who I am.
I like that. And 27 years is such a long time. So you're definitely an expert. You are well versed in what you've been doing. You've just talked to me about a few methods that you do, and you discovered or you've been practicing something that's fairly new to the market that helps give permanent results. But before we get into that, there's so many of us who want to lose weight, or people just talk about often wanting to lose weight and keeping it off, but we don't truly understand what goes into weight loss. And earlier we were having a conversation and you mentioned a study was done and it was discovered that we have about 850 different factors that make us gain weight and maintain our weight. So talk to us about that. What's the psychology of weight loss? Because we like to think about it, but we don't truly understand it. So in your own words, what would you say goes into weight loss? Why do we have the weight? And what are some of the things that we can do to change that?
Yeah, Sheryll, I was really impressed by you telling me that you know what is gastric balloon, you imagine what is gastric sleeve, gastric bypass. One thing you did not hear about psychotherapy for eating habit correction, but we had quite extensive discussion on that.
Yeah.
Yeah. So, but in general, when patients are coming to my clinic, some people are quite informed about different procedures, like you knew some of them, many of them. But some people do not know much. They may come, the patient may ask that I want gastric balloon. Another patient can say, I want gastric sleeve. And when I'm asking, do you know about any other procedures? No. I may ask, do you know about psychotherapy? Many people say no.
Yeah.
So, what is this about extra weight? How people can lose weight, and the most importantly, to maintain weight. My interest to obesity treatment developed around 30 years ago, when I became to know about new method of treatment, which is called psychotherapy for eating habit correction. I always had interest to weight loss since I was a teenager. Just I did not plan to talk about it, but I remember just one girl in my class during the lesson, because there was topic, the teacher was talking about extra weight, and somehow it was like a funny, a little bit conversation, and one girl commented, "It's like Luda." I thought, what is it about me? And she commented that I put on weight. I never noticed it myself.
Oh.
I knew I'm the most beautiful child in the world by the way how my parents brought me and how our society. But when and now when I'm working with my patients, and we know it that how children are discovering something in themselves. So that time I did not even know how to comment, how to respond.
Because it was shocking for you to discover.
I did not tell to my parents about it because I thought maybe it's like not something to talk to parents. But I decided to stop eating, and then I developed even stomach ulcer. It was a lot of problem there. So that was my first experience with extra weight. And then when I became a doctor, and I became to know about the psychotherapeutic method for eating habit correction, and coincidentally I had interest in psychotherapy, and it was like extra course which I did in my university, psychotherapy. So I was not afraid of this field, which many people do not know it, and that is why people are not interested. Some not interested, some afraid of it, because mind is like not very easy to address.
Yeah, it's a very complicated organ.
Very complicated. The most complicated, I think.
It is, yeah.
Yeah. So, but before that, I tried, of course, this starving, which I got a lot of problems. Then, when I became a doctor, I tried medications. I became to know about medicine which is suppressing appetite. I tried that one. I given to my friends and to my patients. It was 30 years ago, and nothing was working. But when I discovered this method, I've seen it has very strong approach to obesity treatment. So method was developed by psychologists, medical doctors, specialists in field of addiction. So that is where these 850 causes are coming. They are the one, this group of scientists, they discovered what is really making people to gain weight, and they described more than 800 different factors which are making people to gain weight.
Yeah.
If someone is saying that I'm gaining weight because it is addiction, or because of my hormones, or because sedentary life. So I mentioned 3. What about other 847 factors? All those factors need to be known.
Yeah.
If you will not know that, then regaining is real. People are regaining weight. It is so-called relapse or in weight loss. So all those causes were grouped into several groups. Subconscious psychological, that is what we were discussing,
Yeah.
about that how we are learning our relationship with the food. People learning eating style, attitude towards the food since the time when we were born. So all this life we are learning this style of eating, our priority in food, our temptation, addiction. So it is, to make it short, it's like those deep knowledge which are deeply encrypted in our subconscious mind. Longer you repeat the same activity, longer you are learning something, more strongly it is encrypted. And that is why to change it in habit, it is like to change any other habit. Like habit to smoke, habit to take alcohol, habit to take drugs, and here we have habit to eat, habit to take sugar, addiction from sugar, addiction from carbohydrates, from all this food. So quite deep topic to discuss, addiction from food.
Yeah.
Like from the childhood, we were taught and encouraged to eat by our parents, but this was done with a love, because our parents, many of them, they did not have enough food, and their parents did not have enough food. There was starvation. So that is why parents were trying to give us the best food and to feed us more and to teach us to eat more. So this encouragement for eating, overeating, was done with a love. But if we are looking now at the society, what is going on, there are a lot of processed food. There are a lot of businesses. Food industry is huge, and now we are encouraged to overeat by the society. We are encouraged to eat all that food by different businesses, and most of this food is not healthy food. Yeah, we are not used to, we are not when human beings appeared on the earth. Often I am talking about it in my interview, but I think to the viewers who did not maybe hear my interview before, it would be good to know about it. So when our ancestors appeared on the earth, they were eating meat, berries, and some cereals. Look at the amount of food we are exposed to. And it is not that we are only exposed to, we are seriously encouraged to eat all that business food. Why? For what is the reason behind encouraging people to eat all this processed food? It's to get a business. So unless person will know about it, unless person will be informed how deeply this our eating habit in our subconscious mind, only then we will know how to start working on it.
Yeah.
So it is a little bit about psychology of that, particularly subconscious mind. And I touched also over consciousness, influence from outside. And another approach in our therapy to weight loss treatment is that people's style of eating is driven by a feeling of hunger. So if patient has extra weight, usually people are eating much more in volume than they really needed, and people feel more extra weight patient has, more in volume patient used to eat and need to eat. Otherwise, person will be hungry. So the approach in the medicine and conclusion and observation and practical experience of doctors shown that if we will make a patient's stomach smaller, then you will eat small amount of food and you will not be hungry. So that is the idea of bariatric tools which we are using in weight loss treatment.
And that leads us to some of the procedures that you have. But what you were talking about is the psychology of our relationship to food, because of the way our parents lived and the lifestyle that we have been accustomed to. So there is a sort of addiction that goes into certain foods. Like I was telling you about earlier, the way I love sugary foods, and the people who love spicy foods, the people who love junk food. And most times we try to look for options, like you were mentioning, appetite suppressants. We look for weight loss teas, we drink green tea, we try to look for other alternative options of losing weight, but we rarely ever address the psychology and the mindset we have towards food. So that's one of the things that you do at your center. You deal with the relationship that we have subconsciously with food, and then you administer the other procedures, which you're talking about now, with you reducing the size of the stomach, reduces the amount of food that we take in. And that's essentially what some of the procedures you do at Nairobi Bariatric Center are for. So I want us to get into that, because initially, people rarely ever understand, we rarely ever think beyond the body. We normally don't think about the mind in relationship to the food that we take in. We like to focus on the body, but we neglect that important aspect. So I think that's one thing that we wanted to make clear. Before you start your weight loss journey, you have to understand your relationship to food. Then you get into the other procedures that you have. So tell us a bit more about some of the options that you have.
Yeah, so our approach in weight loss treatment is a combined approach. And recently I attended Congress in Melbourne, Australia. It was Congress on obesity, surgery and metabolic disorders. And 3 days, doctors from all over the world were discussing obesity problem. Challenges, treatment, failures, successes, difficulties. The conclusion was that up to now, not very clear why people are losing weight and regaining weight. That is, we have to know it, because this is the conclusion of the most reputable organization in weight loss treatment, world organization in weight loss treatment. So you have to know why people are regaining weight. It is not only to lose weight. And there was a lot of discussion, and up to now, question is still open. To me, this question was I was very happy to hear about it, and to me, it was very easy to understand. Why people are regaining weight. And just to say that it is people's fault, it is not people's fault, because we developed this attitude towards food in generations. Can we say it is fault of what of medical professionals, still medical professionals announce that not everything is clear. Still, they said we don't know exactly why. Can we say that we are 100% sure that patients will lose weight and not gain weight again? All those Congress was talking about weight regain. So it is much more, it's quite complicated, but it can be also quite easy. In my view, I can say for me it's very clear, maybe because that time I started with this method of psychological correction of eating habit. We started with addressing patient's mind. We did not start with surgery, we did not start with a balloon. So while working with this specialized, like unique, I can say, method in correction of eating habit, later on we've seen that because of resistance, because not everyone was responding to the treatment, later on we started introducing other methods like bariatric methods. First our method was gastric balloon. We put balloon maybe 17 years ago. My husband, Dr. Shchukina, who died 4 years ago, he is the first one who put gastric balloon in Kenya. Then he was the first one to do gastric bypass in Kenya. He done a lot of gastric sleeves. So we are really the one who introduced weight loss treatment in Kenya. What bariatric procedure does? Bariatric procedures, balloon surgery, different types of surgery we do, but just to summarize all that experience in doing all those procedures for many years, the main aim is to protect patient from hunger. Hunger is a very strong condition, strong feeling, which human being cannot tolerate. When you are hungry, you will eat chapati along the side of the road. Fried in the cancerous oil, is it?
Yeah.
So bariatric procedures are aimed to protect patient from hunger. Gastric balloon, we put gastric balloon inside the stomach. It's silicone balloon. It's like we put maybe 2.5 cups of water. Not 2.5, 1.5, 450 ml. And then this 450 ml will stay in the stomach and giving you a feeling of fullness. And then you eat small amount of food and you are not hungry. But into addition to feeling of hunger, there are very strong encouragement for overeating coming from our mind. So that is where combination of gastric balloon must go with the psychotherapy. Bariatric surgery, it is like permanent procedure. We are reducing size of the stomach. So if we are talking about gastric sleeve, and if we are talking about gastric bypass, anastomosis gastric bypass, the surgeon is reducing size of the stomach, so we have a small stomach, and then they are connecting small intestine to the stomach in that way that food is bypassing like 1.5 meter of digestive system. So on certain place of digestive system we will not have absorption.
And that's the bypass.
This is bypass and mini bypass.
So you connect the stomach directly to, let's say, halfway through the small intestines.
Bypassing like 1.5 meter or maybe 1.3 meter.
Okay.
But looking at the experience, looking at the results, and the main our aim is this restrictive aim, because reducing absorption, even with bypass, if patient overeat, patient may slow down in weight loss and may start regaining weight. I had one patient after gastric bypass. She was 140 kilograms, and when she came after 1 month for consultation, she did not lose weight.
Oh, it was the same exact.
Why I'm talking about her, because it was really unique. All patients after bypass, after sleeve, everyone is losing, especially in the first half a year, 1 year. But this patient 140, and after 1 month still she is 140. I was just looking. I was not lost, or I was not surprised, no. So I asked her, what did you eat this 1 month after surgery? And she said, mashed potato was going very well with me.
So she ate a lot of mashed potatoes. Oh.
Later on, definitely, she joined the psychotherapy. We started working on the food, and she got excellent result.
Because you need the psychotherapy. But I think it's a matter of the mind, because if you're wired to consuming junk food, and you, even after you've done the surgery, and you were used to taking pizzas, burgers, sodas, fries, all this junk food every single day, then for you to just change your diet and completely switch to something healthy, it will take some time. Because the way we're talking about, even our eating habits, those are habits that are wired in our mind. And one thing that we should also clarify, because you're talking about obesity, and people like to think, no, I'm not obese, I'm not this, I'm not that. But we need to calculate our BMI, then find our ideal weight, because most of us are either overweight or underweight. And if you're either or, it's already an unhealthy place that you're at. And if you're overweight, you're already at risk of getting to obesity, because it doesn't take that many extra kilos for you to get to obesity. And the way we're talking about some of the habits that we have, if I've done the surgery, but then I've gone back to the exact same eating patterns and I've done nothing to change that, then I'm still going to gain back the weight. The stomach will still grow back. I will still regain the weight. I'm going to find it hard to fight off all the extra kilos that I've put on. And a few guys have come to your place and they have managed to keep the weight off after the surgeries. So is it because of the psychotherapy that you're doing in addition to that? Is that the key to it? Because if our mind is still wired to eating the same unhealthy foods that we're used to, and we've paid all this money for all this surgery, but we haven't changed those small details, our pantry is still filled with junk food and all these cookies and snacks and cake. So is the psychotherapy vital for you to shed off and keep off the weight?
What is more important, bariatric surgery or gastric balloon as a tool? Because this is just a physical tool, really very powerful tool. But if to put bariatric surgery and to put our mind, our habit, mind resistance to that food which brought you to extra weight, I would say 50-50. Only combination of those two methods can be, I mean, psychotherapy and bariatric procedure can give us success. But it is easy to say that you should eat less, you should not eat this processed food. It's not possible, because there are a very strong knowledge, feelings of temptation, love to the food, which are driving our patients' behavior from deep inside of your mind. It is like to say, drug addicted, oh, you cannot stop taking drugs?
Just
on,
quit.
on yourself, just quit. Or you cannot stop smoking. Or you cannot stop taking alcohol. It's already deeply encrypted in our subconscious mind.
Yeah.
And in physical addiction is there, it's clear, but the most difficult part of our work is to win those knowledge, those psychological programs in relationship to the food. Like
That's the
how
most
we are
difficult.
learning addiction from sugar.
Yeah.
Did you experience it?
Oh no, don't even me and cake. You have to fight me off of cake. But now I'm wondering, what are some practices that I can incorporate or our viewers can incorporate just in our daily life, some small practices to make sure that psychologically we are fighting this habit that we've already nurtured?
When it's always, even since I started weight loss treatment from the 27 years ago, I had in my mind to educate as many people as possible. Somebody was talking that time to me on the national level. I thought, no, how can I reach national level to educate all people, because all people need to know this.
Yeah.
And of course I knew that I cannot win this on the level of Kenya. Definitely I was working already like a medical doctor with individual patients and individual cases, but I always had this in mind, because it is people health, people happiness, because it is really unnecessary to suffer from all those diseases which are caused by obesity. It's not necessary to suffer from diabetes. Diabetes is caused by obesity, and many people do not know this yet. Only few people know. I cannot say, but in Europe, in America, many people know that obesity is leading to diabetes. Obesity is leading to infertility, to high blood pressure, high cholesterol. You can see how many heart diseases we have. Before, we never had, we rarely had like heart attack. My husband, I remember, he used to say, it was not disease of Kenya, because he was before in Kenya. Now, heart attack, stroke, obstructive sleep apnea, so many diseases, 64 different diseases are caused by obesity. It's statement of WHO. So people should know about this problem. Just remind me the question.
What are some things, some small practices that we can do? Yeah. Like, should I lock away the sugar in a cup?
That is. And then been in this field for many years and working with the patients, psychotherapy, introduced bariatric procedures, and I always had in mind how it can. What advice? How can I help society, all society? Because each person is affected by this.
Yeah.
Then I remember I talked to Professor Varaksin, who created this method of psychological correction of eating habit. The method which we are using here in Kenya for this all this time. I remember he said that to address this problem, it should be addressed on the national level. That time, first time he talked to me about it. Then maybe 6 years ago or 7 years ago, I had a visitor in my clinic. She came to do research on obesity. She is from Norway. So when she came to my office, I asked her, would you like some tea, coffee? She said, coffee. I asked her, would you like with sugar? She said, no sugar. I said, interesting, why not? And what she told me, that there in Norway, they have a governmental policy which is educating mothers not to give children sugary stuff. Sweet. So she learned since she was born. She learned it from her mother, and her mother learned from the policy of government. So that is how they are educated. You can see how far rooted all those feelings are. Deeply rooted in our mind.
Yeah.
So I'm just giving you sample.
That's a very clear example.
How they can use it, at least something to use for themselves.
Yeah, because the ultimate goal of losing weight is to live a very healthy lifestyle and to live a longer life, because we're trying to avoid all the complications. We're trying to avoid diabetes, blood pressure, every other condition that comes from diabetes that we can avoid. We should actively start today with the things that are within our control. So I think that's a wonderful way to end this conversation. It's been very, very informative. I have enjoyed it. I hope you guys have enjoyed something about this. And I hope you've taken away a lesson from this, because most times when we're dealing with weight, when we're fighting weight, we fight the body, we forget to fight the mind. So you have to understand your relationship to food. What makes you eat the way you do? Why do you do that? Once you understand that and you can change some of those habits, then you should implement the physical things that are within your control. Please be sure to visit Nairobi Bariatric Center, because she is going to take you through a lot. She can take you through every single thing. And I believe the best way to treat anything is by starting from the mind. And that's the one thing that we have here. That is it for this conversation. I hope you've enjoyed it. You've taken something away from it. We will see you again next time. So have a lovely day. And that's it.